And welcome back. I am Dr. Chris Tomczak from HealthSource.
Dr. Don Bassesi, also from HealthSource.
We've got something interesting to talk about today.
We have something interesting to talk about every day.
If not, we make it up.
Yeah, we try.
Well, this is something unique because everybody's heard of massage out there. Most people have had a massage from somebody, whether or not they were trained, right? What's the difference between what we call a classical massage and deep tissue work, which is the kind of stuff that we do in our HealthSource clinics across the country? Let me use a different word. What we call classical massage, we call it, if you're going to just come in there and kind of nice relaxing stuff, we call that foo-foo massage.
Foo-foo?
You said good stuff. And honestly, you start doing something like that,
oh, yeah.
it feels good.
That's what I'm talking about.
It feels real good.
It does.
But long-term benefits, pretty negligible, pretty small. I mean, you get a nice massage, you go back at your right back at your job, or you got the screaming kids, or whatever the case may be. About 3 hours later, you're right back in the thick of things. Muscles are all tensed up. You're stressed out all over again. Long-term benefit, not a whole lot.
Gotcha.
So we do something different in 254 of our clinics.
Is it hot rocks?
It's not hot rocks.
Whale music.
No whale music.
Enya.
No Enya. No waterfalls either.
What did you come up with?
Whale
song?
No. What we do is deep tissue work. So when someone comes in one of our clinics, we take a look at the soft tissue, because you have to look at the soft tissue because that's oftentimes the source of the problem.
Let's say I don't know what soft tissue is.
Soft tissue is this right here, the muscles, ligaments, tendons. That's soft tissue. You got bone and you got soft tissue, so it's the soft tissue. At least I hope that wasn't
too
too
softer than others, I believe.
We utilize something called the stick.
Wow, that's such a high-tech name.
And the stick is actually new technology. And if anybody's attended any Olympic events or some of the pro events and a lot of the progressive colleges, you'll see these things all over the place.
Yeah, a lot of times when you're watching on TV, you can see off to the sides in the warm-up areas, you'll see them all over the place. The stick. Yeah.
And what this stick does, it's a high-tech torture device. What it does is when you identify a piece of soft tissue or muscle that's knotted up, it's creating stress, maybe it's up here, it's giving you headaches, maybe it's in your lower back, shooting pain down the leg, making it hard to tie your shoes. When you get in and work it out with this torture device, with this high-tech rehab device, the stick, you begin to break up adhesions, you break up the soft tissue knots, and you make lasting, long-term changes. Now, I got to tell you, have you had this done to you recently?
I actually can use it on myself, so I'll use it on my shoulders.
You're pretty talented. Well, we did a talk the other day on Dr. Jim Hoven, who's one of our trainers, trains our new franchises. And I was having a problem with my upper back, and he brought out the stick. And let me tell you this, a couple of minutes with the stick by somebody who knows what they're doing, who's trained, and break up those knots, and you feel, it's a little uncomfortable when you're doing the work, but when they finish, you feel like butter. I mean, and it lasts. It's long-term deep tissue work.
So what it sounds like then is by utilizing devices like this within the HealthSource offices, people are able to get better quicker.
That's the bottom line. Thanks for bringing that up, because if we can get a person better, feeling better faster, and keep them better feeling longer, we've done our job, haven't we?
So that if you're able to really loosen up the muscles at a deep level, as opposed to just on the surface, then a patient may not be required to stay as long for the doc to get, the job done.
That's right. So that's why we use things. This is just one example. Newer techniques like the stick to get our patients feeling better quicker, stay better longer. So you're talking about shorter treatment programs, aren't you?
This sounds awfully like something that's actually best for the patient.
What's best for the patient? Amen. Very good. All right. That being said, classical soft tissue massage feels good. Long-term benefits, not a whole lot. You want things that work for you long-term.
No seagulls in the background in one of our offices.
No whale music. That being said, I am Dr. Chris Tomczak for HealthSource.
Dr. Don Bassesi, also for HealthSource.
Go ahead and look us up on Twitter. Follow us, friend us on Facebook. Follow our blog, Dr. Tomczak. All right, now take care.
Bye-bye.